to move into the lightning round. It's like
Okay.
the most exciting thing in health insurance right here.
Okay.
So let's roll.
Super fast. All right. Mental health parity. Practically every group has to do it already. Like the ACA extended it down to the small group market. Really, the only people that don't have to do it are like level funded small group plans, so or smaller self-funded plans under 50. Practically everybody has to do it. You've had to do it for 13 years. And one of the things that people get tripped up on the most, and this is fully insured plans, file policies all the time that don't meet these requirements, is squishy stuff, what's called the non-quantitative treatment limitations. And it's stuff like, okay, you apply pre-authorization requirements. How did your plan come up with those? How did they decide what treatment services get pre-auth? Why do some, not the others? What if you call to get a 28-day stay pre-authorized and it takes you 24 hours to get that, but a hip replacement gets pre-authorized in 30 seconds? Why is that? Is that discriminatory? Stuff that you've like never even thought about before. But, and again, the employer probably has little to no control over. They want to know about it. So every plan has been required for a long time to be analyzing these and try and get it, make sure that their plan is fair, and no one was doing it. It was like the dirty secret of health insurance. The Department of Labor knows about it. HHS knows nobody was doing it. Insurance commissioners know that, big BUCA plans were filing small group, large group products fully insured all the time that were non-compliant. Well, they've had it. They're done. Started with the Trump administration and the Biden. So it was in that CAA that the Trump administration passed, and now the Biden administration is enforcing it. Everybody has to have these NQTL analysis. They were supposed to have them by February 10th. No one has them, but they need to get them. And if they do not have them, they're going to need to be turned into the Department of Labor and to HHS. If you do not have them, not only are they the same huge fines, they could make you reprocess all of your claims, really screw up your plan, and there's public shaming involved, which is kind of ironic with mental health, but I know. But they will make you tell all of your plan participants that you're not compliant with mental health and substance use disorder parity, and they'll be turning you into Congress, and Congress will be publishing an annual report and listing all of the non-compliant people. And you might be, well, what's the likelihood, Jessica, that I'm going to get caught? Yes, you as an employer, probably little, but guess what they're going to do? They're going to start targeting service providers because they've had it. So if they think, United plan, blah, 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 in whatever, blah, blah, blah state has been problem, the insurance commissioners tip them off or whatever, they're going to go after everybody that has United. And remember, that liability is the same. If you're self-funded, it's on you. If they think that your TPA or your care management entity, or, they think Optum is a big problem, they're going to start going after everybody that uses Optum. I mean, I don't know why I'm picking on United today, but, Optum, United, but whatever, whoever it might be, name a big player or a small player. They think there's a problem, they're going to go after all their clients. And so you need to get these analyses. Again, it's not something you can do yourself. It is super, super hard to do. If you are fully insured, you want to go to your carrier and be like, where are they? They should be making them for all their plan designs right now. I know for a fact, many carriers are scrambling around trying to do it right this minute. And if you are self-funded, you want to go to your TPA and say, where is it? When are you getting it for me? And I will tell you, some of them are saying, we're not going to do it. We don't have to on the TPA side. Push back, because they don't want every employer coming at them and saying, well, we have to do our own now. We've hired a lawyer, we've hired a consultant to do it, and now you're going to have to give us all this information. Because remember, by law, they have to disclose the information back to you. It's going to be annoying for them. They should just do it themselves. It's a lot easier, a lot more cost effective, and they can do it by plan design. And you're going to have to push on them and say, it was supposed to be in my hot little hand by February 10th. When this year are you going to get it for me? I can tell you right now, the Department of Labor knows that nobody has these yet, but within, a few months, they're going to be expecting people to have them on hand. They have issued guidance already on it, and they've said, this is not a best practice anymore. It is required. We will be coming after people for it. And guess what? These big players in the market, they don't want all their clients attacked. They need to get their act together and give you their report. So that's coming out. It's now. It's due now. So that's that one. Section 1. So now we're getting into the COVID stuff. Section 125 plan relief. You've probably heard, this is like all the things. there was notices. It was in the first COVID bill. It was in the last COVID bill. It'll probably be in the next COVID bill. The IRS just keeps on announcing more stuff. They just keep on giving you like flexibility with your 125 plans. They're letting you have new open enrollment periods right now if you want to for health plan elections. People can make changes to their DCAPs. They can roll more money over. The employer, the world is their oyster. You can make all these changes. So first of all, a couple of things. Talk to your cafeteria plan vendor to make sure they're up on this. And two, think about what you want to do, because it's all optional. The employer doesn't have to do any of these things if they don't want to. So I would say a couple of things. You have to be cognizant. They've made the world your oyster. They haven't changed any of the discrimination stuff. So if you allow all this flexibility and more money pouring in and out, you could create non-discrimination problems for your employees. The other thing is there's a lot of administrative changes for this. You're going to have to make plan amendments, and just rolling it out with your employees, informing them, all of the things. And then again, there are non-discrimination issues. And the other thing that you don't want to do is you may have an employee that's heard like, hey, I heard I could put all this money in my dependent care account just for this year. Yes, you can. You can add in $10,500 this year rather than $5,000. And you might have been able to roll over more money. You weren't able to roll over money from dependent care before, but an employer could let you roll up to $5,000, which means you could have 15,500 in your daycare account this year for 2021 in theory. And that's a lot closer to the cost of real daycare, particularly for a baby, most places in the country, than $5,000 is. So you might have an employee that comes to you and says, I want that money. I want to put it aside. And you might say, that is fine, Jessica, but do not, no matter how much I annoy you, just say, okay, Jessica, you can do it. If you're going to do this, you have to do it for Ben, you have to do it for Mike, you have to do it for Katie, you have to do it for all your employees across the board. You can't just tackle my problem. And two, remember, it could cause non-discrimination issues because you could have too many highly compensated employees putting aside all this money and not others. And that's going to come back on a tax issue on me. I'm assuming I'm highly compensated because, why not? If I'm in this fictional world, I make a lot of money. So the highly compensated employees could suffer. So here's the thing. It's not my job to tell you what to do. You can do all the things, but I would strongly caution you to think return on investment. If you're going to just make Jessica happy with this DCAP stuff, is it worth it? If you are going to make all of your employees super happy by letting them, change their health FSA elections this year, go for it. Just think about it, because there is administrative challenges. And if you make any of these changes, make sure your vendors can handle it and that they're going to update your documents on time so that you don't get out of compliance. All right, open enrollment and premium tax credits. So there's a lot of relief out there to help people afford health insurance. One of them is that there's a new open enrollment period for the health insurance exchanges, and they've made it a lot easier for people to qualify for individual market subsidies. If you offer them employer sponsor coverage and it's affordable and minimum value, you just technically do not qualify for an exchange subsidy. And there used to be, you didn't have to know how much your employees made for their whole household income. They could still get an exchange subsidy because their household income was lower than you thought. You just had to make it affordable, meet the affordability standard for your employee. And it was based on the single employee rate. Now, that's still all true. There's more people that might actually fall into that it's really not affordable for them standard. So two things that you have to think about as an employer. One, if you are risk adverse and you just don't want to get any penalty liability, make sure your affordability safe harbors are airtight. If you are a large employer, make sure you're meeting them. And if you are a large employer and you don't really care if a few people go to the exchange and get a subsidy because their coverage was not affordable, and you're like, I'm going to run the risk for some of my lowest income people, it is much better for me financially to run the risk that I will get a $3,000 penalty for that person than to change everybody's rates and contribute that much more to premiums. That's fine. Just know you might have a few more people that you're paying the $3,000 penalty on this year, just because more people are going to be eligible for those subsidies. So it's just something to be aware of. And I know that Ben and Mike and their whole teams are going to be talking about this with you this year when you set your premium contribution rates for the year ahead and like what you want to do. No wrong answer. All right, the next one is the Cobra Subsidies. You've probably all heard about it. Cobra's free now. This is for the next 6 months, but not for everyone. It applies to people that involuntarily lost their coverage or had a reduction of hours and qualified for Cobra that way. What is an involuntary termination of employment, you ask me, Jessica? Fortunately, we don't really know because they didn't really define it. I would say be more generous than less generous. It doesn't include if you were fired for gross misconduct. That's definitely not it. That's really the only thing that they've specified. So you've got that going on. It's for 6 months. There are a lot of notices involved because it's not just people that currently have this happen to and qualify for COBRA. You have to go back 18 months, and anybody that was involuntarily terminated from employment or reduced their hours and qualified for COBRA with that are still kind of in that 18 months window. If they had picked COBRA back then, if they enrolled and they're still on your COBRA, they get the subsidies. If they said, no, I don't want the COBRA, 15 months ago, you have to go back to them and say, hey, new opportunity. You don't get extra time on COBRA, but you do get 3 months of subsidy if you want to come back on. And you don't have to have any coverage in between then. And also, if you were on and then you stop paying, you have to tell them that they can have the opportunity to come back. No, not everybody can do that. If you are on another employer-sponsored plan or you have access to another employer-sponsored plan, you don't get free COBRA. If you can go on your spouse, if you were terminated tomorrow involuntarily, you were laid off and you have eligibility to get on your spouse's plan, or you are 23 and you can get on your parents' plan, you don't get free COBRA. If you were on the exchange, you could get free COBRA. You lose your subsidy, but you could go get on COBRA. If you were on Medicaid, you could go get free COBRA. So it's kind of tricky. The main thing for employers are COBRA vendor. Need to talk to them. Make sure they're on the up and up. There are notices that need to be given out. You get in trouble if they're not. There's very specific timeframes. You want to make sure they're giving out the notices. You have to tell people that they're eligible for this. You have to process it. You have to reach out to those people. The COBRA vendor is going to want to know from you who you think might be eligible. So you have to go back and look. And then also when people's subsidies are ending, you have to tell them ahead of time. And a lot of people, that's going to be in September. But some of them, depending on when their window ends, it could be earlier than that. Also, keep in mind that they have given out subsidies for COBRA before. And they extended them the last time. So it might not be at the end in September. I don't know. And the other thing is look at your COBRA vendor contract, because if you have one, there may be some excess fees involved with all of this going on. They may even have something built in from the last time, because they may have something like, hey, if there's subsidized COBRA or there's new notices or something required by law, there may trigger something. So check that out. Contracts, very, very important, is one of your main takeaways from this. The other thing, so we do have some FAQs out there if you're curious about this. When you give out those notices, one of the things that you give out is an FAQ to the possibly eligible former employees or reduced hour employees. There's also FAQs out there on their website for you if you want to look at them. We do still have a lot of questions. We expect more guidance. Don't exactly know what's involuntary. What if somebody thinks they deserve it and they want to appeal, and how does that work? They don't know yet. There's probably going to be something. Another thing to think about is if you've already been paying somebody's COBRA, maybe if you're using retention tax credit money to do that, you can put them on the Cobra Subsidy, but you can't get it for, you can't double dip. And if you've agreed with someone with their severance package to pay for their COBRA and you're just paying for it, and then you're like, well, now you're on the free COBRA, you may have some legal issues there because that was compensation you agreed to legally. Like, how does that work out? And like from the COBRA subsidy perspective, like, can they get on the COBRA subsidy? I don't know. And then if they can, do you have legal liability? Like, that's something you might want to talk to an employment lawyer about. And then what if like the subsidy, like say you get the subsidy, right? And we're going to talk about the outbreak period now. You know, people haven't had to pay for COBRA, they could back pay. What if they get the free COBRA and then we're still in the outbreak period? Can they just keep not paying? I don't know. So speaking of that outbreak period, we're getting to the end here. This is winding down. So again, remember like this inside baseball stuff. So the Trump administration put out that outbreak period rule that suspended lots of deadlines relative to health plans, including COBRA. Also special enrollment notices, claims notices, you guys giving out notices to people. That was all kind of suspended the deadlines because of COVID. But the thing was, I think they thought, I'm not really sure what their rationale here was. My guess is that they thought we would be done with COVID by now because their authority to do so only lasted for 1 year. And guess what? The year's up. So the Biden administration was like, oh no, like, do we have all these people overnight? Like the outbreak period had like a transition to kind of like get us out of this once the national emergency ended. But if the authority ends, like, does everyone get kicked off and have to start paying all these things and issuing notices like crazy overnight on March 1st? So they decided, okay, no, that's too complicated for all of us. So in one way, they gave us a breather. We didn't have to completely panic on March 1st, but they kind of stretched out the work. So everybody, depending on their qualifying event date, that's when their 1 year starts of delays. So if somebody qualifies for COBRA today or has a HIPAA special enrollment, qualifying event today, they have 1 year or when the national emergency period ends. If their qualifying event was April 25th of last year, they've got a few more days left of their outbreak period relief. Okay. So we have to track this on an individual basis. And to elect these COBRA subsidies, you have to do it within the 60-day window. Like they have 60 days to decide if they want the free COBRA. And you have deadlines to inform them. You don't get deadline relief for that. But in terms of paying premiums, you have some outbreak period rights. No one really knows, do they still apply to this? Kind of seems like yes, they do. So we're waiting for guidance on that. So there's a lot there. Basically, COBRA in particular, a hot mess, and your COBRA vendor more important than ever. And if you administer COBRA yourself, I am sorry, we will try and help you, but it is going to be tricky for you because COVID stinks. I'm sorry. Like that's really kind of the only answer. So that is my fast and furious part. Hit me with the questions, Ben and Mike and Katie.
Yeah, so if you have any questions, feel free to put them in the Q&A box. From my perspective, you brought up a couple things with the Section 125 updates. What I love is that you highlighted administrative complications and a return on investment. So one question to ask yourself is how many people are actually submitting to the maximum of these things that they'd want to even put in more? What we've typically found, again, this is the employer's decision and every employer is different. But if I was going to take all employers and put them in a giant bucket, I would say that likely making these adjustments just further complicates things. And your employees who already probably don't totally understand how all of these things work are now going to get a different set of rules than they've ever been given before. Now they're really going to be confused. So I'd weigh that very carefully. Most employers, I would say, should probably just avoid making those changes because then you got to change it back. But that is your decision as an employer, and each employer really needs to walk through that evaluation on their own. And then the exchange subsidies, I love that you brought up. Make sure you know what your safe harbor provision is and where you fall on that line for if someone goes to the exchange and gets a subsidy or not. One thing I'd like to add is, and you even mentioned it, Jessica, that a lot of you are paying like net. So after employee contributions, like $7,000 per employee per year for coverage. The penalty is actually less. So something to consider as you're looking at that safe harbor and trying to make it so it fits for your corporate budget, but also so it fits within a value offering for your workforce. So, you know, it does pay to really think through that as an organization.
Yeah, and unfortunately, most people don't actually go to the exchange and trigger the subsidy. It's actually a pretty low percentage, but it is something to just think about of like know how many people it could be, and you could get a letter, you could pay a penalty, you know, you're going to have to respond to that. You are taking a calculated risk, and that's fine. But I don't think like anybody likes to take a risk and not know what could happen next. So it's just important to consider and say, am I okay with this? And like, am I prepared? And just know that there's potential for consequences, and the consequences could be financially much more, you know, you can be completely cool with them and made a responsible financial choice. Just make a responsible financial choice either way. Or if you're like, I just can't handle the uncertainty, I just don't want to do that. I don't want anyone to go to the exchange. It's a value to me to provide this. I get that it's probably cost, you know, like that I'm okay with that. I want to do that for employees. Fine, wonderful. Do that too. Just make an informed decision is all we're saying.
Absolutely. You know, we have one of our company foundational values is no surprises. So I think it falls under the fact that if you're not expecting there's a likelihood for a penalty to arrive and it actually comes, that's a surprise, and that doesn't ever feel good.
Right.
So we had somebody ask if they can get a copy of the slides. That's Jessica's call, so I'll allow her to answer that.
Sure.
Yeah, so we'll send those out to everybody. But we've reached the end of our time here, and thanks for sticking with us as we run a little over. But Jessica did a phenomenal job. I'm always just wildly impressed at how interested that I get in compliance when you're speaking. So well done on that front. And I can speak on behalf of Mike and Connor Insurance that we're so glad that everyone joined us this morning. And even though there's a lot here, find confidence that we have, we're leading the charge on this from a consultant perspective, and we have tremendous people that are supporting us, not only at our teams, but specifically with MZQ Consulting, with Jessica and her team. We have an army behind us that are wanting to make this a success for you. So thanks again for joining us today, and have a good rest of the day.